In this lesson, we want to look particularly on the role of hormones in human reproduction. We shall begin with secondary sexual characteristics in male. And we have a region in the brain called hypothalamus that stimulates pituitary gland located in the kidney to release follicle stimulating hormone and luteinizing hormone. These two hormones are gonadotrophic hormones. So follicle stimulating hormone, denoted as abbreviated as FSH, stimulates the synthesis and maturation of sperms. LH stimulates the interstitial cells to release androgens. And testosterone is the main androgen that stimulates development of secondary sexual characteristics like broadening of the shoulders, deepening of the voice due to enlargement of larynx, hair at the pubic area, armpit and the chin regions. Penis and testes enlarge and begin producing sperms, and the body becomes more masculine. In female, the secondary sexual characteristics include enlargement of mammary glands or the breasts. Hair grows around the pubic and the armpit regions. The hips widen. Ovaries become mature to produce ova. Menses begin to start. And we have hypothalamus to stimulating the pituitary gland to release gonadotrophic hormones FSH and LH. So FSH, or follicle stimulating hormone, stimulates the ovary to release estrogen hormone and triggers development of the Graafian follicle in the ovary. Again, estrogen triggers the onset of the secondary sexual characteristics. So we want to look, having looked at those hormones, estrogen, we want to look at what happens during a menstrual cycle. So during menstruation, actually menstrual cycle is characterized by discharge of blood and some tissue debris called the menses from the uterus every 28 days. And it results from the breakdown of the uterine wall that occur when the level of progesterone falls and the girl starts to receive menses. Before menses, there are some nausea experienced, abdominal pains, back pains, some girls diarrhea, among other changes. So these abdominal pains are the ones called cramps, and some are very painful, such that some of you do not want to attend classes or use them as an excuse, or they are actually so painful, but you have to bear with that. And then after menstruation, the anterior lobe of the pituitary gland starts secreting the follicle stimulating hormone that causes the Graafian follicle to develop into the ovary. So FSH makes the Graafian follicle to become the ovary. FSH also makes the ovary tissue to secrete estrogen, and estrogen is the main hormone in females, or androgen. Then estrogen brings about repair and healing of the endometrium, which had been destroyed during menstruation. And remember, we said there is a breakdown of the uterine wall when progesterone has fallen down. So what will heal that endometrium is the estrogen. And then estrogen level stimulates the pituitary gland to produce LH. This LH causes the maturation of the Graafian follicle to release the ovum into the oviduct, a process called ovulation. So this is ovulation actually is the fertile days of a woman. So in case such a woman practices or does sexual intercourse during this period of ovulation, then there is high chances of pregnancy. And you can easily count the fertile days from the last day of menstruation, and then moving on, there are some fertile days around that place. So it depends whether that the woman is having a cycle of 28 days or 32 days. But remember, the case is not safe, as it is likely pregnancy is likely or conception is likely to occur. So after releasing the ovum, the Graafian follicle changes into corpus luteum. Now LH again makes the corpus luteum to secrete progesterone that stimulates the thickening and vascularization of the endometrium. Vascularization is that the supply of blood vessels, and this one prepares the uterine wall for implantation of blastocyst if fertilization takes place. If fertilization takes place, the progesterone level increases, and that inhibits follicle stimulating hormone follicle stimulating hormone from maturing into another follicle. Then, if fertilization does not occur, corpus luteum breaks and the level of progesterone goes down. Then endometrium is shed off and menstruation occur. So these are the two hormones, estrogen and progesterone, that are actively involved in the menstruation. So we have menopause, and this is the permanent end of menstruation and fertility, and it is a gradual process signified by a decrease in the number of Graafian follicles. Secretion of estrogen also decline, may begin from 40 up to 50, and that is when there is a irregular menstrual cycle, and it eventually ceases. And the symptoms include night sweat, random hot flush during the day, the vagina becomes dry, and there is loss of minerals like calcium that leads to softening of bones, a condition called as osteoporosis. So you might have heard women of this age complaining of back pain, among other things. So we have the minerals are lost. Then we want to see what cesarean delivery is, and this is a surgical procedure that involves the cutting of the abdominal and uterine walls for the delivery of the baby, and it happens when there are complications such that the fetus cannot pass through the birth canal. Then we move to parental care, and it is an attention given to the newborn by providing food and protection, and it is shown by placental mammals, where after the newborn is fed with milk produced by the mammary glands. So we have a number of hormones that aid in parental care. We have prolactin hormone produced by the pituitary glands that makes the breast or mammary glands to produce milk. So remember, this time the mother should not be stressed, so that there is the milk let down. The milk should just flow without any psychological disturbance to the mother. And when even the mother is far away from the baby, even a cry of a baby stimulates even these mammary glands to produce milk. At this time also the mother should eat health, so that all the nutrients are availed to the baby. And the baby, remember, should be only breastfed for the first 6 months before weaning begins. So we have oxytocin hormone also that stimulates contraction of muscles around the areolar tissue in the mammary gland, so that to squeeze milk to be available for suckling by the baby. Then here is a table summarizing the functions of all these hormones we have been discussing. So there is the hormone, and then the source, and even the functioning. For instance, prolactin we have just talked about, produced by the pituitary gland and initiates production and secretion of milk. Among these, so go through this table. We wind up with this assignment, that particular lesson also complete.